Now, the CDC unveiled and issued new guidelines today for schools to reopen safely. The guidance advises schools to reopen in accordance to outbreaks in their areas and also incorporates health guidelines like wearing masks, physical distancing, and monitoring levels of spread. Joining us now is Dr. Ann Liu, an infectious disease physician over at Stanford Health Care. Dr. Liu, thanks so much for joining us today.
My pleasure. It's nice to talk to you.
Nice to speak to you as well. Now, do you think it's the right time to get some of the schools open in the state and here in the Bay Area?
I think there's now a lot of data on how school reopenings can be done safely, even in situations where there is still virus circulating in the community. Certainly, the lower the virus levels in the community, the easier it is to reopen and not have cases in schools. But still, there's lots of experience now about school reopenings where lots of different measures have been layered together. Whether it's, certainly masking is an absolute must, but also distancing, reducing the number of kids within classrooms, spacing them out, and rotating kids' schedules, doing hybrid learning, and in some cases doing more testing. And I'm hoping that testing and also vaccination will become part of the plan, and layering all of these things together will help our schools reopen safely. I have to say that I have been incredibly impressed by the schools that have instituted all kinds of really creative measures to keep kids and staff safe. And the schools around here that have opened, I have seen just use such innovative approaches and have been really science-based, evidence-based in their approaches, and have been really successful in bringing some kids back to school from families where that has been the choice that they have made, the choice they've been making.
Yes, and it appears that science really should be what leads these decisions to be made, and if there are safeguards in place to reopen safely, they should be followed. We do know that just over the course of the last year, our experience with COVID, a lot of the transmissions haven't been in very young children. But the CDC is saying that we are seeing an increasing number of positive cases in the younger students, and teachers aren't necessarily required to be vaccinated under these new guidelines. Given the increase that we're seeing in positive cases in the younger age children and teachers not being required to be vaccinated just yet, is it still enough? Are these safeguards still enough to be able to open safely? Because children do need to get back to school. I mean, there's no doubt about that. But is it enough to reopen safely where a child won't necessarily, will be protected from potentially getting it from another child and then taking it home? Are these safeguards essentially enough?
I think it's always in the details. So where masking is required, that has to be really followed carefully. So, it can't just be we suggest masks and about half the kids aren't wearing masks. So when you layer together testing and frequent hand washing, consistent masking, sometimes eye protection under the right circumstances, then I think that we can protect teachers and staff by reducing the number of infections that are transmitted in schools. Most of the infections that have been picked up in teachers, staff, students have been community acquired, not acquired in schools. There's actually been very few transmissions in schools when those measures are all followed. So, it's not, I think, a binary vaccine makes it safe, without vaccines it's unsafe. I think it's very much a continuum and has to take into account all the other measures that are being taken, and making sure that those measures are followed diligently and not in a random way.
And my last question for you, Dr. Liu, I know we have to let you go soon, but the CDC, I guess, issued a color-coded kind of grid saying, low risk versus high risk, saying that if a school is in a high-risk area or there is a large number of infections, that doesn't necessarily preclude the school from reopening. They could still reopen if those safeguards are still in place. What are your thoughts on that?
I think that's very true, that if those safeguards are followed really carefully, then even when there is a fair amount of virus in the community, schools can still reopen safely with not a lot of infections. I'm not going to say that there will be no infections and no transmissions, but when those safeguards are followed, then I think things can be done quite safely. But it takes so much energy, so much work, and I know that the schools where there have been hybrid learning or kids coming back in person. It has taken an incredible amount of time and energy and coordination and really air traffic control. And I admire them hugely for doing that and putting in all that time and effort. But I think it can be done.
Absolutely. Well, it is good to hear from experts that students or children can return to school and be safe despite, a number of positive cases within a community. Dr. Liu, is there anything else, I guess, that you want to leave with our viewers before we let you go?
I just want to give a shout out to all the teachers and staff at schools where they're doing all of these different measures. And I think we also need to take into account that it takes resources. It takes resources to adjust air filtration and to have masks and testing and whatever we can do to make sure that our schools have those resources so that teachers feel safe and that kids can be spaced out and have those safety measures in place. We should try to do, because it's so important.
Absolutely. Well, Dr. Ann Liu with Stanford Health Care, we really appreciate your time. Thanks for joining us today.
Pleasure. Thank you.